Hello viewers and you're welcome. This is a chat with the professional, the show that has been designed to x-ray the activities of professional individuals and corporate bodies. My name is Martin Sobu and I'm sure glad to be with you. Today we are serving you something very fresh, refreshingly different from the stables of the Federal Ministry of Health, Federal Republic of Nigeria. Some time ago, if you remember, I had the Honorable Minister of Health who talked to us about what they are doing in the ministry. We talked about data, we talked about international funding for the activities of the ministry. But since then, a lot have happened. I personally have witnessed the Honorable Minister going around on inspections. I personally also was thrilled with his activities during the bombing of the UN building in Abuja. And that's why today on A Chat with the Professional, we are having the Honorable Minister of Health to be our first guest in the year 2012. He will today be talking to us about what has happened between the last time we had him on the show and now, the year 2012. Let's see if we are progressing or retrogressing, but I will leave that for him to do when we get back from this break. Please stay. You're welcome back. You're still watching A Chat with the Professional, and like I mentioned in my introduction today, once again, we are having here with me to discuss a couple of issues bordering on our national existence. The Honorable Minister of Health and the person of Professor Onyebuchi Chukwu. You're welcome to the show.
Thank you very much.
Like I also mentioned in my introduction, you know, we've had Professor Chukwu sometime towards the end of Good Luck Yar'Adua administration, and then he was reappointed to once again do what he knows best how to do. Honorable Minister, I must say, without perhaps trying to patronize, that we are on A Chat with the Professional quite impressed with some of the things we've seen you do. For the very first time, I saw you during the UN building bomb blast. A serving minister coming out to say openly, this is the casualty figure. I've never witnessed that, and we must say congratulations on that alone.
Thank you very much.
Taking it from there, we seem to have exposed some of our inefficiencies, some of which you had mentioned in our previous interaction, that I remembered quoting you, you said, we are doing well, but we have not done well enough. What are the issues that we could learn or pick from the UN building bomb blast?
That was on the 26th
Yes.
of August,
August.
2011. First, the lesson there really is that we should be prepared at all times.
Okay.
Because the unexpected does not want. So that's why it's unexpected. So the unexpected happened on that day. The second thing we need to learn in terms of lesson is that there must be a predictable system.
Okay.
We did well, for which even the United Nations openly commended Nigeria. But then it was because of our personal effort, the way all of us, all stakeholders felt, from the Minister of Health, in fact, indeed from the President, down to the ordinary health worker, and other stakeholders, you know, the fire service, NEMA, Federal Road Safety Corps, the police, private ambulance operators. Everybody had, you know, their hands on deck. So that personal committee covered some of the areas we needed to do things. That's in terms of predictability. We need to have a system in place that one can predict. 3 is capacity. Okay. Even capacity for the hospitals to receive. You could see that National Hospital received everybody, but then once they've done the initial resuscitation, the initial acute management, they now felt it was time to move some of the patients to some other hospitals. So there's need to have more and more to have capacity. 3 is that it was clear to Nigerians that when we say that people should donate blood, that is the right way. Nigerians responded, and for once I was so proud of them. They responded, people came out. But can we do it on a routine basis?
Yes.
Not only on fire brigade approach.
Yeah.
So we learned that lesson, that there's need to build up our capacity for the support services like the blood transfusion service.
Okay.
Then the other lesson we learned, which worked well, was that no single stakeholder can do it alone when it comes to disaster management. All the relevant stakeholders must continue to work as a team. So we learned a lesson, and of course, finally, is that we need to do something, and that
yes.
means we have started doing it. I can
Good.
tell you that. First week of December this year, which means roughly about 4 weeks ago, we did have a major international stakeholders meeting on emergency response in the health sector.
Okay.
Now, we did not limit it to trauma, even though trauma has become the common emergency these days. And we say some new forms of trauma are coming up, but emergency is emergency. There are some emergency people have never talked about. So I said, fine, I don't want this forum to discuss only trauma.
Yes.
Please, can you discuss what we should do for that middle-aged man who suddenly has a heart attack at his office or at home? What do we do when a woman who was expecting that her normal date for delivery will be in 2 weeks' time and suddenly goes into labor?
Yes.
And she's alone. The husband traveled in the knowledge that, it wouldn't much be needed until 2 weeks. What do we do when that young woman who is asthmatic suddenly goes into severe acute, what we call status asthmaticus? What do we do? How is that person going to be rescued? So we are not only talking about trauma. So we had that stakeholders forum 4 weeks ago. The preliminary report from the forum is on my table. We've already started studying. Indeed, we've already started acting some of the part.
Okay.
Like we've also already getting engaged, speaking with some of the people who want to do a PPP arrangement with us. And we are thinking seriously that the private sector must play the role if you want to sustain it. So there are lessons that we've learned, but we've taken action. Then, in the issue of capacity, I'm happy to inform you that with the recent bomb blast in Niger State, that actually we have actually started looking at what we started doing since the experience. Now, I visited a number of hospitals for the second time, really, to see how they were being faring. And when we went to the University of Abuja, after seeing the patients, reviewing with the management how they were being taken care of, I said, let's see the progress in the work we are doing in terms of your new as an emergency block, which has been under construction. There's been an improvement from the stage from where I saw it on the 26th. If you may recollect, I was at the same hospital on the 26th, although we didn't know that was going to happen, but from there I left them. So I said, fine, you've made some progress. And we've set a timeline for ourselves that by this time next year, we should have put that building to use. So it's something we've set a target for, we are going to work towards it. Now, if you go there, you'll be proud. This is a very big building dedicated to accident and emergency. And the front, already, I had an MRD, there's some trials, dry run. 2 helicopters can land in front, so the helipad is already there in place. Then when we visited National Hospital the same day, after seeing the patients, I also requested I wanted to see the work in progress, because in May, when I last visited National Hospital, I saw how far we're moving on with the new trauma center. Obviously, it has really progressed to our satisfaction. Again, if you go there, you'll be proud. That one timeline is even coming earlier. We're saying we should be able to begin to use that building from July next year. So we've set some timeline by which people can even judge us. We're not afraid. We believe that all things being equal, like the economists will say, July, National Hospital, next year, Abuja. Then when it's December, University of Abuja Teaching Hospital. So we're building that capacity. Again, in the case of National Hospital, the helipad is on top of the roof. So we're working towards providing that capacity.
Well, I know that you are one man who relies so much on data. I remember that the last time I had you, we also dwell so much on that. And from some of the actions I've seen you taking, it does appear that we are getting to the promised land with data. You just mentioned some of the developments in Abuja. And I was just wondering, let's just assume, God forbid, but should we have an emergency in, let's say, Oshogbo or in Afikpo, for instance, do we have other federal institutions around there, or are you satisfied with what the states are doing? How can we ensure that we have a coordinated health policy that works, that ensures that wherever you are, in any part of this country, you know, you are able to access quality health services?
Yes, we've never said that FCT is the only place in Nigeria. Okay. Yes, it's the only one that is exclusively federal. Okay. But then, a Nigerian is a Nigerian, and the president is the president of Nigeria. Okay. And the Minister of Health is the Minister of Health of the Federal Republic of Nigeria. So, obviously, we're going to work with the states and local government. But let me say one thing. Some states are doing well. Even from the stakeholders forum, it was clear. For instance, Lagos State presented their experience, and even people from abroad are like, wow, we have been criticizing Nigeria unjustly. Some places are doing well. We can't take that away from them. Yes. So people praised Lagos State for what they put in place in terms of emergency response. Okay. So that is one state. So it's not as if states are doing nothing. That is not true. Some states have been doing things, and it's not only Lagos State. Niger State is also equally doing things. Yes. So we commend those states that are doing well, and we want to all those states that are not doing too well to copy, emulate the ones that are. We're not even asking them to emulate the federal government. Emulate your fellow states. Yes, that's the way to go. Peer review, peer pressure, and all that. So, but the question you asked, do we have even federal centers? Why not? You talked of Oshogbo. Okay, Oshogbo is Osun State. Yes. Remember, we have the Obafemi Awolowo University Hospital, and this is one hospital that is waiting for a formal presidential commission for the upgrading of facilities we did there. Good. So we've upgraded the facilities there. I did a pre-commissioning visit, and I was so thrilled. I told Nigerians so that things were in place, and of course we started using the facilities, but still the president will eventually do a formal commissioning because it's a presidential project. Okay. So Oshogbo and Osun and and Ile-Ife are not too far apart. So with what we're now trying to put in place, if we can work hand in hand with Osun's government, with the private sector, that on the major highways and around Osun State, we have even the private sector, state government, and even federal having their ambulance services available. There's no reason where if there's a disaster and mind you now, even the NEMA has awarded contract, we approved in fact, for them to get their first really dedicated to NEMA ambulance helicopter, and it's so well equipped. So they're acquiring, but you know they're expensive, so we'll start somewhere. So by then, hopefully, even the ambulance from NEMA, which is special air ambulance, will have arrived. So why can't they lift people to the nearest one? It could even be UCH that is even nearer in which is in Ibadan. So either way, we'll be able to have a hospital that will receive. But what is important is the pre-hospital management. So the rescue must be there. The appropriate transportation must be there. That's what we're working hard. And so NEMA was part of that discussion. Then even if it were Afikpo, why not? Maybe it's no more news to you that the president has upgraded the FMC in Abakaliki to a teaching hospital because of that area wasn't so well served. So there is something there, you know. And in terms of building for trauma, it's one of the areas we're looking into. Okay. So I can assure you that yes, it may take some time, but what is important is to work towards your goal. So now we're no longer sitting down, we're working towards our goal.
Okay, thank you very much. Viewers, at this point, we must take a break. Please don't go anywhere. We'll be back.
Professional handshake. Professional profile.
Nigeria is the most important country in sub-Saharan Africa.
In-depth analysis of professional issues.
Of education, the collapse of culture in Nigeria. Even with cheating, we can't pass. With the enormity of the cheating.
We've not done enough. There's still more to be done.
Join Martin Zobu every week on this channel as he chats with the professionals on the program. A chat with the professionals. A program designed to x-ray the activities of professional individuals and corporate bodies.
Hello viewers, and you're welcome.
Join us.
Welcome back. You're still watching A Chat with the Professional, and my guest remains the Honorable Minister of Health, Federal Republic of Nigeria, Professor Onyebuchi Chukwu. Before we went on break, he has tried to talk about accident and emergency, how prepared we are, what the federal government has done, and what the government is still doing to ensure that we are well equipped to handle emergencies wherever they may occur across the country. Right now, we are going to leave accident. By the way, while we were talking, you mentioned, you gave some timeline, and you were mentioning July next year. I'm sure you are still thinking about 2011. We are now in 2012.
When I say July next year, it is this year.
Okay.
This year, not 2013. This year.
It's all right.
Thank you.
So now, away from emergency, we've been acquiring equipment. Let's take it from the VAMED project. The last time we talked, I think you mentioned something about the VAMED project being in the last lap. We've acquired several equipment. Do we have enough manpower? And then what do we have on ground to ensure that these equipment are well maintained? Because acquiring equipment is one thing, but putting them into proper use and ensuring that they last is another.
We don't have enough manpower, and it's not something Nigeria will be ashamed of. United States of America does not have enough health manpower. That's why they need Nigerians and other foreigners to work there.
Yes.
The United Kingdom, as small as they are, still does not have enough manpower in the health sector. So no country does, not even Japan, not even China. So just like any other country in the world, Nigeria too does not have enough. But we, relatively speaking, we could do better if we look into the distribution. Part of the problem is distribution. I believe that whereas we've not met what should be the standard really in terms of population to be served, but I believe that if we can redistribute, we'll do that better. Presently, our health professionals, like other professionals, are concentrated around the major cities like Lagos, Abuja, Kano, Port Harcourt, Enugu.
Yes.
And so leaving the relatively rural areas without much to gather for. So that is one. We don't have enough. You've talked about equipping. Yes, we've not completely done all the equipping. Remember that we kept talking about even further upgrading of some other hospitals.
Okay.
It's still on, it's a continuous process. As we have upgraded some, we'll continue with others. So it's done in phases.
Okay.
So that suggests, the fact that we're doing them in phases suggests to you that presently, as we are speaking, we cannot claim that we have adequate facilities all around. Okay. So what is important is that we're working towards that. Yeah. In terms of the human resources too, number is one thing. Being functional is another thing. Yeah. So, and that's why we also have started looking at how do we encourage, how do we motivate, how do we discipline our workforce to ensure that they give us value for money. Yes. We're working hard on that. At least those that belong to the federal government. And I guess a number of state governors are also equally trying to work on that. Yes. Then in terms of improvement of facilities, as the federal government is improving facilities, we are calling on the private sector, whether in country or in diaspora, to also come and invest. Okay. We're inviting them. We're asking the state government to do more. And quite a number of state governments are also investing. So something is being done.
But is the environment conducive and attractive well enough to these professionals? Because you just said something about not having enough manpower. And I agree with you that, of course, you and I know that U.S. health system is largely sustained by Nigerian professionals. It's not a disputed fact, no matter how modest we try to be. What do you think we can do to attract them? Because what is happening now is somehow embarrassing. A situation where for every single individual now that has a kidney problem, the next thing is there's an appeal to raise money to travel to India. You know, for every single health issue, somebody is talking about traveling to India. And I'm beginning to ask, for all this amount of money that we waste traveling abroad, couldn't we convert, even if it's half of it? Can't we achieve something, attracting, be it Nigerian professionals, be it foreigners? I couldn't be bothered so long as we have qualitative health services, you know, in the country, so that we save all this revenue and also create employment for our people.
First, there's an inherent propensity to go for foreign goods and services. Even ordinary dry cleaning clothes. You know, some Nigerians go abroad to dry clean. Is it that we don't have water in Nigeria?
Yeah.
Is it that we cannot procure those chemicals needed for dry cleaning? Is it that we don't have people that can be trained or people who are practicing dry cleaning? No. Again, globalization has brought issues. Globalization is not to the advantage of the developing countries.
Yeah.
Reason is that if you are saying that for globalization you want to go for the best, I know that for today the developed countries are still the leaders in most of those areas. But that is not to say that we can't do what they are doing. But overall, they are the cutting edge of the technology of the profession. So if you are saying where is the best place for this, obviously it may not necessarily be Nigeria. When I came in newly as a minister, one of the things I was confronted was an albino. Now we wanted to begin to partner with the Albino Foundation because the albinos have peculiar health problems. Some of them cancers. For instance, squamous cell carcinoma is very common. Why? Because they are not, because they have a lack of the pigment, the melanin, that's what it's called, that protects us from actinic rays. So they lack it relatively. So what happens is that the sun, the actinic rays from the sun, often has a deleterious effect on their skin, and they develop all sorts of skin cancers, apart from visual problems and so on. But let's take skin cancers. So this boy, who was brought to us, many people remember his name, Philip. So he was brought to us, and they said, Minister, can the ministry help to treat? Now, ordinarily, the Ministry of Health does not have the mandate, really, to handle social welfare. We have other MDAs that actually have the mandate. But we now looked at it and said, well, we can call it our own corporate social responsibility, that we saw this, which is a health problem, but in an individual, we can see whether we can sponsor it as a corporate social responsibility. And we did that. And how did we do it? We said, do you have any hospital you've been going to? So initially they say yes. We say, we are national hospital. We say, do you have an estimate? They say yes. Bring the estimate. We saw it was 1 point something or 2 million between that. And they did the due process that was to go. And we said, well, for transparency, since this came from National Hospital, we pay by electronic transfer to National Hospital account. And we did that. But later we found that people were not quite happy with that procedure. On one hand, they should thank us for that, but on the other hand, they were quarreling that they didn't know we were giving the money to the hospital. And then they started spreading the propaganda that they found that National Hospital could not do it, and that they need to go to India. So we need to recover that money so that they use it. So I said, no. How did you get this estimate? They said they were attending. So we confirmed actually that he had a file. We confirmed actually that the consultant was attending to him. So we asked once again, even though we knew the truth, that normally they couldn't handle it, they would have referred. Said no, they can handle it. That's why they gave an estimate. And so eventually we ensured that Philip had it. Philip is doing well. It was done in Nigeria. We didn't have to leave the country to do it. But if we had backed out, they were gone abroad. And people claim that that case couldn't be done in Nigeria. So I'm just giving you an example. Now, what is the second reason why people go abroad? People are also going abroad because they think one's government can sponsor. So you find people like me, if I know, if we apply to Mr. President, say, the minister is ready to sponsor, then automatically, even if it's just a little lump that could be exercised by a junior doctor, I want to go abroad and do it because I'm not paying it from my pocket. So we're looking into that seriously, and the government is saying, fine, a time will come very soon, probably this year, that we're going to say, okay, fine. If you are a public servant or even any Nigerian that the government wants to assist, the Minister of Health should be able to say in writing that this thing cannot be done in Nigeria.
Cannot be handled here. Good.
Either due to lack of facility or due to lack of expertise. It has to commit it in writing. Only under that kind of condition should we, if we have the money as government, then sponsor the treatment outside Nigeria. If the minister says no, we can do it here, then as an individual, basic human right, you are still entitled to say, okay, I have my own money. My doctor resides in some country outside Nigeria. You have that right to go. But then government will not spend the money that belongs to all of us to pay for it. That is one. Then, what's the third reason why people go abroad? Unfortunately, that's to me maybe the hardest part of my job. We further now saw that there are some unscrupulous medical practitioners who are making money from this. They split fees with people outside this country. And so they don't give a damn. Reliable information at my disposal shows that they get between 10 to 15% of whatever that patient is going to be charged.
Alright viewers, I'm afraid that's the much time would permit on a chat with the professional today. By next week, we shall be bringing you the concluding part of that interview with the Honorable Minister of Health. Hopefully, come next week also, we are going to get reaction from Nigerian public on how they perceive the health sector. And that's to spice up the concluding part of the interview with the Honorable Minister of Health. This is with a view to giving an insight into what Nigerians feel about the achievement or activities of the government of the day. So till next week when I come your way, remember, a chat to the professional has been designed to x-ray the activities of professional individuals and corporate bodies. And this year, 2012, we are hoping to achieve a lot more. We have so much in stock for you, our viewers, especially the youth, who we try as much as we can to inspire through some of these professionals that we feature weekly. We are encouraging you to draw inspiration from them and then aspire to be even greater, so that Nigeria of tomorrow will indeed be greater than Nigeria of today. So till next week then, I'll see you.